And before we do that, I'm sorry to interrupt. I
start the recording again. So again, thank you for everyone for joining us tonight. This is a very important topic. We're really excited to be able to focus on the patient and North Carolina Medicaid and what these changes are. Our community needs access to healthcare and also to providers that understand the bleeding disorders community needs. I want to thank Mike Leighs, Deputy Director of Engagement for North Carolina Medicaid, and the North Carolina Medicaid Department for offering to help our community to better understand the changes that they need in order to be stronger advocates when it comes to healthcare. Thank you, Mike. And I'm going to make you presenter. Actually, Jillian, you need to do it because you're host.
I think I did it.
Great, thank you. Should I share my screen?
Mm-hmm. Yeah.
Great. Let's see. You never know if this is gonna work. Can you guys see my slides?
Yep, sure can.
Excellent. Let me just put it into a. There we go. Do you see the full size slides?
Perfect.
Great. Well, thank you so much, Charlene, for that introduction, and Jillian for inviting me. Appreciate you both allowing this forum. I did want to introduce my colleague, Kathy, who has joined me this evening. She's a new member of our team, and we are thrilled to have her on board, and she'll be helping me track some questions and any items that we need for follow-up. So please know that up front, that I'm happy to stay as long as you need for me to answer as many questions as you have, but if there are some that we need to track down, we are happy to do that and follow up with you. So with that, again, thank you for having me tonight. Thank you for joining at 7:18 on a cold Tuesday night to learn about Medicaid transformation. I really appreciate your interest, and this is a big deal. So we are very thankful for opportunities we have to connect with great community organizations who want to learn more about this transformation, and for organizations who feel strongly about advocacy and feel strongly about improving healthcare here in North Carolina. So we really appreciate an opportunity like this. So a quick introduction. My name is Mike Leighs. I'm the Deputy Director of Engagement with NC Medicaid. Been with the department a couple of years. I have been working in a variety of capacities. We are working heavily on Medicaid transformation, but as you know, we are also very, very involved in the pandemic response. And so all of us have played a role in responding to COVID-19. That has been really a huge undertaking by our department. At the same time, we do have other business that we have to continue moving forward, and transformation is one of those things. So before I dive in, let me go to this sort of vision setting. I like to slide because we really want folks to think about this move in a holistic way, and we really think it's an opportunity for us to improve the health of North Carolinians. It's a whole person, patient-centered model. So we're delivering behavioral health care as well as physical health care, and we want coordinated. We want to also acknowledge the many non-medical drivers of health. There's so many things, so many factors that influence our health that are outside of the healthcare space. So our Secretary Cohen, is a huge advocate to think about what are the ways we can spend money that really improves people's health. And so it might mean access to transportation, access to food. So we're going to be doing cool things like that as a part of transformation as well. One thing I want to do is take you back, and Charlene, thank you for this reminder. This process to move to managed care, it started 5 years ago. So this was 2015. There was legislation that was passed in our General Assembly that moved our entire Medicaid program to a managed care model. And I'll get into some of the definitions of what that means. But in essence, it is relying on private health plans to deliver the care for our Medicaid beneficiaries. The sort of older way of doing that is fee for service. So a provider is a Medicaid provider. They provide a checkup. They send the bill to NC Medicaid, and we pay them for that cost. It's just between NC Medicaid and the provider. Now we're moving to managed care, which, by the way, is a very common model, and we're actually one of the biggest states, if not the biggest state, that has not moved to this yet. So there's some states like California who have been doing this for 20 plus years, where they rely on private health insurers to manage the care of the Medicaid population in that state. So this is a long time coming. It's been 5 years in building, because it is a complex thing to undertake. Our program is 50 years old. We celebrated our 50th anniversary last year of Medicaid in North Carolina. This is the biggest change that the program has ever gone through. So this is something that takes a lot of effort, a lot of groundwork to build a program like this. And now we're getting very close to the launch. So that's exciting. You may remember, if you were involved in this a year ago, we did come close to launching Medicaid managed care last year. We had to pause it because the state didn't end up with a budget, a final passed budget that allowed the funding that we needed to implement the program. So it paused. We had anticipated going live in 2019 with managed care. We had to pause that because of the budget not making it to the finish line. We got an additional round of funding in July that the legislature passed through a bill, Senate Bill 808. That bill provided us the funding that we needed to keep going and build out the infrastructure and launch the managed care program. So we had a stop last year. We are back in full speed ahead and preparing for our full launch next year in 2021. And I'll get into some of those details in a minute. So let me start with kind of overall how things are changing. So the new program is North Carolina Medicaid Managed Care. And we have still, though, the current program will exist, a smaller group of folks. So that's going to be called NC Medicaid Direct. And so when I was discussing this fee-for-service model, physician provides care to you, the physician bills North Carolina Medicaid directly. That's going to continue for a smaller group of folks as we transition. The vast majority of folks who are in Medicaid, it's about 2.2 million people in North Carolina, the vast majority of those folks will be moving to these health plans to get their health care. You'll see at the bottom, there's nothing will change about eligibility. So the way folks are determined for Medicaid eligibility, working through their local Department of Social Services office in their county, all of the criteria that applies, it's quite detailed in terms of the different categories that someone can apply for to be eligible for Medicaid. None of that changes. This is really how the care will be delivered that's changing.
I just touched that.
So let me go into a bit more detail about these health plans. So I mentioned that now the care will be provided by health plans. There's really sort of 4 plans to think about. The standard plans, these are the plans that most folks will enroll in. And so these are names, I'll get to the names in a couple of slides. They're names you'll recognize, and they're gonna provide your standard health care, but also integrated physical and behavioral health, pharmacy, really an integrated full service model of care for our Medicaid beneficiaries. There's also a plan called behavioral health tailored plans. This will be for a much smaller group of folks, maybe around 150,000 folks. These are individuals in our state who are currently getting care through our LME MCOs. And these are folks with very a high level of behavioral health needs and severe behavioral health conditions. Traumatic brain injuries would fall under this category as well. We just released a couple weeks ago an RFA for plans. The existing plans are called, again, I apologize, this world in Medicaid has an awful lot of acronyms. So the local management entity, managed care organizations, These are entities right now that are providing behavioral health services. They will continue to, and there's a new RFA to have them continue that work. That won't start for another year after the standard plan. So that will be 2022 for a much smaller group of folks who have very severe behavioral health conditions. There's also going to be a plan that we will develop within the next year for children in foster care. So this was a very vulnerable group that we heard from advocates and other experts and felt strongly about internally that this was a group that needed a specialized plan as well. That will be developed in the next year. And then the final one in the bottom right will launch at the same time as the standard plan. So this is the EBCI tribal option. So Eastern Band of Cherokee Indians, they will be operating their own health plan. There'll be a limited number of folks who can enroll, and it's folks who are eligible for Indian Health Services and are members of the tribe and are living in the counties that are in the western part of the state that are currently getting services through Cherokee Indian Health Authority. That's the managed care entity that will be serving this population. This is a smaller group of folks. This is about 4,000 folks who would be eligible for this. So again, 4 plans you see here. The standard plan in the upper left is what the vast majority of folks who are in Medicaid will transition to here. So let's talk about when that happens. Next July 1st, 2021, that's the big day. That's when it goes live. That's when folks' healthcare will flip over to being delivered by health plans versus the individual fee-for-service model that I mentioned. And it's about 1.6, 1.8 million folks who are Medicaid and NC Choice beneficiaries will transition to Medicaid managed care. And NC Health Choice is our children's health insurance program. And so this is a smaller group of folks who, families who have a bit higher income than the typical Medicaid beneficiary, and they're eligible for the same benefits. They're included in this group. There are a smaller number of folks, maybe 150,000 or so, but the number overall is quite large, and it's the vast majority of our current Medicaid population that will move on July 1 to the new health plans. So just the level set, a health plan, it's a group of doctors, hospitals, you know, if you have private insurance or you have had Medicaid in another state, perhaps you're used to working with a health plan, might be Blue Cross Blue Shield, might be United Health, and you have a relationship with them, you have a card, you have access to their website, and they outline all of the benefits that you have, and they are the ones who are really responsible for managing your care. So I talked about the numbers here. So most people will have to make this choice, that 1.8 million number. Some can stay in Medicaid Direct. They will have a choice. There's a small group who will have a choice. But those who have to make this choice will get a letter. So we are mailing out a huge mailing of a couple million letters that will go out in early March to start to. We're going to do a lot of communications before that. We'll do events like this. We'll do social media. We'll do a lot of other things to let folks know. But the letters are going to be one of the real specific items that folks will get to realize that they have this choice. And then at the bottom, I'm going to talk a little, the second to last bullet. Let me pause on that. We did have a number of folks. It wasn't a large number of folks. Last time, when I mentioned we started moving to managed care in 2019, we did have some folks who got far enough along that they chose a health plan. And then we had to pause. We had to pause because we didn't have the funding. Those folks will still need again. So this is a full restart that folks will need to select another plan, even if they did last time. And in the final bullet is if folks don't make that selection, we have a process called auto enrollment. And so auto enrollment is a typical process in any managed care, whether it's Medicaid or private insurance. And what that is, and maybe some of you have gone through this yourself, if you've gotten notices from your health plan about making a selection and you don't take any action, there will be an automatic sort of default action. And so we have an algorithm that uses a bunch of factors. Who's your current provider? How close are you to that provider? Are your family members with that existing provider? A lot of different factors that go into a model that will do an automatic selection that will be hopefully a good match, but we really encourage people to take the time, educate yourself about the options in the 5 health plans that I mentioned so that you can make an active choice, so you can really decide which one is best for you. So that's really what we encourage folks to do. So the folks I alluded to who have an option, who have a choice, and so those are the folks who are the member of the qualified who qualify for Indian Health Services, or they live in the counties in Western North Carolina who can choose from the Eastern Band of Cherokee Indian. They will have a choice of that plan or the other mention. If you have behavioral health needs, you could get in the tailored plan that I mentioned. You also to consider a standard plan, because remember,
So I'm not sure if it's just me. Is it skipping out? Okay, I think we just lost.
Okay, because I just got a notification that my internet is stable.
So we can I can
you hear me all right?
I can't. Your presentation disappeared.
Breaking up. It's breaking
Yeah,
up.
you were breaking up, and then your presentation disappeared.
It disappeared?
Yeah, it did.
Okay, 1 second.
I'd offer to keep going for you, but I have limitations. And one thing that I've seen help is when you're presenting, if you turn off, not that we don't want to see. Sorry, it muted me. If you turn off your camera while you're presenting, for some reason, I guess the bandwidth, it doesn't take as much.
Okay, did that help?
I still don't see your screen.
Okay.
And I am copying all of the questions just so everyone knows. So if you have questions, you can add them to the chat and I'm keeping track of them.
We might be able to pull up the presentation unless you made changes to it from a couple days ago.
So I moved a little bit closer to my Wi-Fi. Can you hear me okay now?
We can hear you good. Still can't see the presentation, but we can hear you.
Okay, let me see what I can do here.
And we have the one you sent a few days ago. So if that one is still current and it's easier for us to try and pull it up.
Yeah, let's do that. I'm not sure why it won't show anymore. I think I was on slide 8. Would you mind bringing that up?
Yeah, no problem. Jillian, if you don't have it open yet, I'm going to the email. So.
Okay, I was just gonna go get it. Let me know if you can't find it.
Got it. So give us just 1 second.
Let me try once more.
Okay, it's working. It's on.
Okay, I think I just had to get back to a better connection. Okay, so you're seeing a slide that says who cannot choose a health plan?
Yes, if you want to go into presentation mode, but otherwise we can see it.
Okay, does that look full size now?
Yep, perfect.
Great. I'm sorry about that. I have this one room in my house. It's fine most of the time, and then every now and then the Wi-Fi quits on me. So
Well, I loved your wall color, your paint color.
yeah, maybe maybe get a little bit of a tour then, a brief tour as I was running downstairs. I got to get better Wi-Fi. So sorry about that. So let me get back, and I'll just start from the beginning on this slide. So there's folks who won't get notices from us because they do not have to make any change, and these are folks who are in the innovation waiver for disabled folks, those with traumatic brain injury, our community alternatives program for children, or CAP-C, and then also for disabled adults, which we call CAP-DA. And then folks who are dually eligible for Medicare and Medicaid, they are not going to get a notification because they will stay in Medicaid fee for service. And so that's the folks who will not have a choice of these health plans. So they will not get those notifications because they will continue getting health care exactly the way that they always have been. So let me get back to the choice process. You know, as you look at ways to choose a plan, it's really you know, many of the things about the providers that you like and trust, right? So do you want to keep your current doctor or clinic? And so what a lot of doctors were doing last time, they have to get into a contract with one of these health plans, and what they would do is they would let their patients know that I have contracted with health plan A, I have contracted with health plan B, and if you want to stay in the practice, you know, explore those options to enroll. And so those are really, I think, where most people start, right? If you can have access to the providers that you had been seeing and you like seeing them, you want to make sure that they are part of one of these new health plans. So that's really you know, a good place to start. And if there are special health needs, what added services do they have? So some of the plans may have special services that could help with weight loss, or special services that would help with smoking cessation. And so just to pause a little bit, I'm going to actually jump to the next slide. But before I go there, I want to remind folks that Medicaid eligibility stays the same. Also, what was covered in Medicaid will stay the same. So your office visits, your blood tests, x-rays, everything that was covered before per Medicaid will stay the same. But some plans will offer some additional programs that folks can access. And I mentioned some of the things around obesity prevention, or quitting smoking, or promoting healthy pregnancies. And the plans will be very clear about what those extra services are. So again, that's another reason we really encourage folks to take their time during open enrollment and choose a plan that is best for them. So the 5 plans that most folks will select from are up here on the screen: AmeriHealth, Carolina Complete Health, WellCare, Healthy Blue, which is a Blue Cross Blue Shield product, and then United Healthcare. And then, as I mentioned, the EBCI tribal option will be available for this smaller group of folks who qualify, which is about 4,000 folks. They'll receive their benefits through CHIA, which is the EBCI health plan. So let me go to this map. And so this map, just a little bit of history, this was really important last time we led up to the launch of managed care, because we were going to do it regionally. So we were going to phase in, starting with a couple regions, and then wait a few months to see how that was going in terms of implementation, and then launching statewide. So what we felt, though, is we had done so much prep in leading up to that in 2019, that this time around, we felt that it would be easier just to do a statewide launch. So it's certainly easier message-wise. It's easier for folks to understand that every region on the map, everyone in the state, will be joining managed care on July 1, everyone who is eligible. There's one caveat, though, why the map is still important, and that is because one of our health plans is regional. So Carolina Complete Health is only in regions 3, 4, and 5. So that is one consideration when folks are choosing. They will have to be a resident of those counties if they want to choose Carolina Complete Health. But the map itself, a lot less confusing this time around. Everybody goes live on July 1st. So here's some important dates that I want to pause on, the milestones here as we move to July 1, which is coming quicker than you think. This year is already almost wrapped up. We got less than a month left. But we launched on November 1st, our managed care website. And this is what we call an enrollment broker. So this is a third-party website that we contracted with to really serve as the unbiased source of where folks can go access information about health plans, and they can just access information about managed care. So the website is at the bottom, which is ncmedicaidplans.gov. And I really encourage folks to visit the site. We're going to continue to add content. Right now, there's sort of some of the overview of this change. A lot of the information that I talked about is there. We'll see more beginning in January. Then you can start looking up to find details on providers and health plans that are available. Then March 1st is really an important date, where that's where the call center opens up. And so this is in prep for 2 weeks later, which I think the next slide has. Yes, is open enrollment. So March 15th is a really important date. That's the start of the time when folks have a choice to choose one of these health plans. That will run for 2 months. So folks will have 2 months to visit the website and make their selection. And if they don't make the selection, the auto enrollment begins on the 15th. And so that is a short process. And essentially that will assign folks who have not made a choice in the open enrollment period to a health plan and a provider. And then you'll see the launch date is actually July 1. So really March is when things start, the activity starts to really increase. And then you'll see the choice period, end of choice period, which I haven't talked about yet. So if you have missed the deadline, right, and you were auto-enrolled, but you still wanted to choose a different plan than the one that was assigned to you, you do have until the end of September to make that choice. And we want to give folks as much discretion and as much flexibility to get in the plan that they think is right for them. So we extend another 3 months the ability to make the switch after the start of managed care. So how do you enroll? Just to get to some of the basics. So you'll get an enrollment packet in the mail. I mentioned the huge amount of mailings we're going to be doing at the beginning of March. You can choose a primary care plan and health plan through that. You can also use the website to review choices, which will have even more information. And then if you have an NC Medicaid beneficiary, you can do a secure login to select the health plan through the website. And then after you make that selection, you'll get a much bigger welcome packet from your health plan with the new ID card. And then you'll be ready to use those services on July 1st, 2021. So it's a pretty straightforward process. And I do want to pause here. This is different than applying for Medicaid, right? These are folks who are already in Medicaid. The same process to apply for Medicaid, which is online through our ePass service, is still separate from this process, which is for folks who are already enrolled in Medicaid. There's a mobile app that we're going to have as well that'll be launched March 1. And so this is going to be something you can download for Apple and Android. And this is going to be, just yet another portal where folks can view their options for primary care providers and health plans. And nowadays, this is really a must, I think, to make sure folks are engaged and meet folks where they're at. So we're excited about the launch of that at the beginning of March as another way people can access the programs. And so that'll be prominently displayed on the website beginning on March 1st, and you can easily click through and download the app. So let me pause with the resources page. And this is one that I just was thinking this afternoon I wanted to update, because the website we've spent a lot of time on is the enrollment broker website, medicaidplans.gov. So really encourage people to keep going there, to start going there and look at information that's available now. There will be much more information, and it really is the hub that we want people to visit to get more information on health plans. There's another resource that we're really excited about, and we literally launched it about 5 hours ago. So we did a press release this afternoon on the Medicaid beneficiary portal, which is a really cool new addition to our website, where it was the beneficiary section of our website has been really reimagined and is much more user-friendly. And so this is a place where folks who are already enrolled in Medicaid can come to get questions answered. It will link out to this information on health plans, but then also people who are interested in applying for Medicaid. This is going to be a really straightforward portal where they can learn about eligibility, and then they can actually move forward with processing an application. So I really encourage folks to go to that website. If you just Google NC Medicaid, it'll take you to our homepage, and if you go to the beneficiary section of our homepage, this portal will come up, and it's a great new resource that we're really excited about, and I encourage folks to check it out. So that was a lot of information, and I know even as I'm walking through this information, it feels like a lot, and I know that there's probably a lot of questions, and I would be happy to pause there. And I don't know if you've gotten some from the chat, Charlene, or
yeah.
if you, I know there were some you had sent me before.
I've got those, and we've gotten some in the chat. So I figure if you just want me to ask the questions and you respond, does that work for you?
Absolutely.
Okay. And then after we get through these, again, I just want to make sure we, some of these questions were submitted by people who can't be on. So while we have it recorded, I want to ask those plus the ones that have already come in the chat. And then again, anyone who wants to open up their mic. Do you want to keep the resources page up, or do you want to stop sharing?
Yeah, I can stop sharing. Let me do that. I'm hesitant now with my bad Wi-Fi. Oh, did I pull it off? Did that work okay?
Yep, it worked. Perfect.
I'm even gonna start video. I'm getting really ambitious.
Woo! Yeah, whole new room. You're right. All right. So you answered, and I'm just for the benefit of people knowing what was pre-submitted, a summary of what the transition is, fee for service, the managed care. You answered when can patients begin to select their primary care physician. What is the deadline to select? What would be the deadline to change it if a person misses that? You covered that in your slide. How will information of the transition be sent out to patients? Should they be checking mail, email, phone? You explained that as well. Early March, we'll start a bunch of mailings, social media, events like this. Who do I call if I have questions? Would the portal be the best first stop for them?
Yeah, so there's a couple different options. So if it is really specific about the plans and the choices, I would definitely start with the enrollment broker. And so that on the resource page that I had up, the NC Medicaidplans.gov, on their homepage, there will prominently be displayed their call center. It's not live yet. That's one of the things that will be coming online beginning March 1st. That is really the best way to speak to someone about this choice.
Great, thank you. And then what if somebody enrolls in Medicaid during the transition or after the transition? How does that work as far as picking their providers and all that good stuff?
Yeah, so it kind of depends on what time. So if someone were to enroll during open enrollment, they would be faced with the same packet that others would receive to outline all of the choices. And if they if they came in after, though, we still want to recreate that option and give people that choice period. Also, the ability to change if they have indicated a plan is not for them. So I should have reiterated this at the beginning. We want to be incredibly flexible about folks getting in the right plan, right? So if you enroll in Medicaid, if you become eligible, you select a plan, or if we select one for you through open enrollment, there is still that flexibility plan, that flexibility timeframe that you can switch, that you can have that choice period that we would extend for folks even after this intro period where we're starting on the timeline I showed you. If folks come into the program later, we still want to allow the choice period to get folks into the right plan.
Thank you. And patients with bleeding disorders go to hemophilia treatment centers for care that's specific to their condition. We are fortunate to have 5 hemophilia treatment centers in North Carolina, plus 2 other hematology centers throughout the state. There are many cases where someone might go to a treatment center that is outside of their region. I know you were showing the map.
Yeah.
Will they be able to still go to their preferred treatment center?
Yeah, so it's a great question, and this is really why you want to check out the plans, right? And so we have network adequacy requirements where plans have to offer a certain number of providers to cover the geography that they're going to serve. So there has to be time and distance factors that we look at to ensure that there's a robust network of providers. So that's one thing that all plans have to provide. And there shouldn't be a restriction about what region you're in if you want to go to another provider. But that has to be, there will be in-network considerations, right? So that's why you always would want to check with that health plan if one of those other centers is in the network, right? So that's something that you could compare across health plans, and there wouldn't be a natural restriction just because it is in a different area of the state, but it would have to be a covered provider. And hopefully it would be, right, with the health plans, but that's something that would be a great thing to make sure and check on, right, before you're making those selections, and a key thing to ask the plans before you enroll. But there's nothing about the program that would limit you regionally. It's just going to be comparing the health plans and what providers are in their networks. We hope all of them have really robust networks to choose from. But again, that's something to make sure you ask for specifically when you're researching the plans.
And I'm going to jump questions then because this will tie in. How do you know who your provider is enrolled with? What's the best way for someone to find that out?
Yeah, so there's going to be the lookup function that I mentioned that's going to be coming online, but then also I would encourage you to just ask. So if you have a relationship with your provider, the lookup is a tool, but also double check by just asking. And I know last time as we moved to the launch in 2019, providers were very open and explicit with their patients. And they said, look, I know you have this choice coming up. Just so you know, I have chosen the contract with 3 of the 5 plans. I've chosen the contract with 1. I've chosen the contract with all 5. Here they are. And so I think that is a really important way to stay up to speed. The relationship between folks and their providers is very strong. So that's a way to as well. We will do our best to continue to populate the search function, but just talking to your provider and finding out who they are partnering with is a great way too.
Yeah, and I will highlight that point too, because I've had, and this wasn't with Medicaid, but where I thought that a provider was in network because the insurance company's website showed it, but they actually didn't contract that year. It was outdated info. So again, I know this might not be the case with Medicaid, but my primary care physician said, just always call us, double check before enrollment period ends. So I would really highlight that point to contact the provider. Would it be the same? A lot of our community members get their medication from specialty pharmacies or pharmacies. In order to find out if the specialty pharmacy is a network, would the best option for them to be to call the specialty pharmacy and check?
Yeah, absolutely. Again, you should be able to learn. You should be able to find out through our search functions, but I really echo what you just said. Just, knowing how data can change and be out of date, I would just call and explain the situation and double check that they're still contracted and make sure that there's no disruption there.
Great, thank you. And then what happens to my child's Medicaid when they turn 19? What are their options?
So that's it's really going to depend. So and this is where I direct people back to the beneficiary portal I just mentioned on our website, where if folks are fairly familiar with Medicaid, there's a long list of eligibility, right? And we have right on our beneficiary portal, one of the first pages has that spreadsheet of different eligibility. So it depends what that child's situation is, right? If it's a child who has a disability, they would continue to have coverage. If it's a child who is aging out of the foster system, they are covered from age 19 to 26. So it really depends on that child's situation. It could be, though, that it could be that Medicaid would end for them after age 18. So it really is looking through the eligibility criteria to see if after 18 they meet some of those other categories. But for a lot of folks, there is not eligibility, and we are not a state that has expanded Medicaid. And so there's some states who would have a lot more options for folks to continue on Medicaid based on some of the eligibility around income. So that's a bit of a, I know that's a bit of a tangential discussion, but it's important as well because it does impact the number of folks who are able to get coverage.
Sounds good, thank you. And then I think we already covered this one. Will the process to receive Medicaid remain the same? So like you said, you still have to enroll. There's an area on the website for people to enroll. So I think we covered that one. And I will make sure that when we're communicating with community members, I thought it was a good point that you made that even if you chose a primary care provider last year when we thought this was rolling out, they need to choose again, correct? Like nothing that you chose last year is current.
Yes, that's exactly right. That folks will have to make the selection again.
And then are we able to distribute your slide deck to attendees?
Absolutely.
Okay, great. And then for a person who does not qualify for Medicaid at this time, will there be some type of benefit for them during the transformation?
Yeah, so that was sort of what I was getting at in my last answer. Eligibility stays the same. So if someone doesn't qualify for Medicaid at all right now, this transformation won't change that. I did mention many states have expanded Medicaid, and so their eligibility groups have increased, and they've added new folks who are now eligible for Medicaid. But the transformation itself, it won't change anything about the eligibility criteria that is in place today.
Great. And then I started typing them out. And then this may be too specific of a question, but just in case you do have the answer to it, if not, we'll circle back offline about traditional Medicaid benefits are going to remain unchanged. Some plans might have additional items. Do you happen to know whether any of the plans will have additional PT, OT, SLP, so physical therapy visits allowed?
Yeah, so that I think you're right. It's too specific. I couldn't say right now, not knowing the specific offerings on all the plans, but
Yeah.
That's a great example of things to look for. And the plans will have the ability, and I'm sure they will do a really good job of sharing what differentiates them from other plans. So I think that is a great example of things to go look for and really take your time when open enrollment starts, to be looking for the plans that may offer something that the other plan right next door doesn't offer, and it might be a service that you're really looking for. So that's a great example of something to investigate when we have the open enrollment option in March.
Sounds good. And then can you clarify what the roles of the current MCOs, so managed care organizations, will be in this new system?
Sure. So we just issued an RFA, and I can't say much about it because when we do issue an RFA, there's a silent period. But essentially, the RFA for these tailored plans is what I mentioned as the other health plan. They will operate beginning in 2022. So it's going to be a year after the launch of the standard plans, and they will serve this smaller population of folks with a high level of behavioral health needs and severe needs. And so the only folks who can apply, though, for that RFA are the current LME MCOs. So that's the first, I believe, for the first 4 years of the contract period, they are the only ones eligible to apply for serving folks through the tailored plan. So that's sort of the best way to summarize that.
Okay. And then once someone is enrolled in a plan, how often can they change plans?
That's a great question. And, there's the choice period that ends at the end of September. I don't know if we put a limit on how many times you can switch. I'm going to have to check that one out and get back to you. That's a great question.
Okay, wonderful. And we will we'll make the answer public when we send out an email about this recording being available. If you have the answer, Mike, we'll put it in that email so everyone on here will get that as well as anyone else. And then the only other question that I have written down, so if there's any others, you can put them in the chat or get ready to unmute yourself. Do you know, so people with bleeding disorders need medication. Do you know if any of the plans are going to have restrictions to what types of medications? How will like the preferred drug list and things like that, will that be the same for all insurance companies, or will somebody have to check with the individual insurers to find out if their bleeding disorder medication will be covered?
Yeah, so I'm going to double check this, and I'd like to write back to you on that, but that should stay the same as our current list with Medicaid today. But I want to double check that one too and loop back with you about the preferred drug list. But there shouldn't be any disruption there, and I want to double check before I share that out.
Yes, thank you. I appreciate that. And again, that's it for the questions that I have written down. Are there other questions that folks have? And I'll give it an extra minute too, because I know looks like Ron is busy translating. So just to make sure if there's any that need to be translated back to English.
So I have a question.
Yeah, go ahead, Kathy.
So Mike, thank you for this excellent presentation. I know you've said it 6 times, this doesn't apply. Medicaid expansion has nothing to do with what you're talking about. Do you have any insider feel for whether this newly elected state legislature is going to do anything about Medicaid expansion?
Boy, that's a good question. And so I guess where I'd start is, I know last legislative session, there were a couple proposals that were introduced to expand access to care. And so I think that this is an issue that continues to be really important. And I think a lot of legislators on both sides of the aisle do really prioritize looking at ways to expand access to care. So I would say from our point of view, our secretary has been a real vocal advocate for expansion. And I don't know how much you've tracked her, but she is really passionate about the opportunity we have to expand coverage, and other states that have done it have seen really great benefits. And so we're going to continue to share a lot of those really great stories that we're seeing in other states, whether that's Ohio tackling their opioid epidemic. We're seeing other states dramatically drive down the percentage of uninsured with expansion, and really having success stories. So we'll keep lifting that up. But I do really believe that healthcare is an issue that gets a ton of attention on both sides of the aisle, and we're hopeful to continue to having discussions about ways we can increase access. And I think with the legislature coming back next month, we're very open to continue having those discussions, because it's such an important issue. And I think folks on both sides of the aisle really believe that.
Oh, I hope you're right. Thank you.
I agree. We'll keep pushing for it. Any other questions?
I have a question.
Yeah.
And it's kind of a two-parter. Mike, thank you for presenting tonight. We really appreciate it. Just to make sure I understand, so the current MCOs, Alliance, Sandhills, et cetera, those will essentially be replaced until 2022, and then will become effective again towards the tailored plans. Is that, am I summing that up correctly?
Folks who are the MCOs are currently operating today and will continue to do that until 2022. And so that's the RFA that was just released a month or so ago, or just a few weeks ago. That would be for the tailored plans that would launch on 2022. So that's, a year and a half from now. But folks who are currently receiving services today from their LME MCO are continuing to receive those services from their LME MCOs.
Okay. And I know, so those LME MCOs, they offer certain services, care coordination, IDD coordination, and also some certain crisis services with 24-hour access to behavioral health services and mobile crisis and assessment, things like that. People on the standard plans, will they be contacting their standard insurance company for those services, or do they still go to the current MCOs?
Folks who would choose standard plans, they can get those services through the standard plans.
Okay, thank you.
Did you know Curtis was a social worker by his question?
I may have guessed. It's a good question.
It is a great question, and a very important one, especially right now.
So I have a question. I guess I'm coming behind Curtis when you said that they will be able to get that access through the standard plan. Now, and I know what you're saying with the different insurance companies. So would you have to check with the different insurance companies to see if that would be available, or pretty much all of them are going to have that if you need that access to crisis and stuff like that, what Curtis was talking about?
Yeah, so they have to offer, so if you go back to the beginning, this is the standard plans are offering whole person care. So it is behavioral health as well as physical health. And so that is all integrated. So this is a new model in that these standard plans are offering integrated whole person care. So that's a sort of basic function that you're seeing from the standard plans to ensure that whole person care is available. I would always encourage, if there's something specific that you're looking for, to continue to investigate all of the plans offering, but that is inherent in what the standard plans are offering, the behavioral health services for that integrated whole person care.
Okay, thank you.
Now we had another question in the chat. With managed Medicaid, will a person be limited as to ER visits monthly, MD versus monthly, et cetera?
So in terms of limits, again, this is going to be very specific to the plans, right? Like in terms of a cap on how many times you can go to the ED, I really couldn't speculate. I mean, if someone has to go to the emergency department, they have to go, you know. So I don't think that's something that you'd see a cap on. But I think again, it's really just looking at what each of the plans would have in terms of guidelines for certain types of visits, whether it's, you know, specialty providers or your primary care physician. That's really where I would encourage folks to just get more acclimated with the specific offerings of each plan to find out more about that.
Got it. Any other questions? I'll give it that awkward pause moment while I pull up my notes to make sure I don't forget anything. All right. Well, thank you all. And thank you, Mike. This was absolutely amazing. I learned a lot. I know everybody did. And just really appreciate you doing this. I do want to quickly let everybody know what HNC Hemophilia North Carolina is doing with our part. So we are currently working on postcards that we're going to send out to anybody in North Carolina with a bleeding disorder that we know of. We're also going to be sending out emails, doing newsletter articles and social media posts, especially as the transition nears and deadlines come. We're going to work with our hemophilia treatment centers to help spread the word to patients that might not be in our mailing list, because we don't know everybody with a bleeding disorder, but the vast majority of them do go to hemophilia treatment centers. We'll ask our treatment centers to please hand out the postcards during clinic. Of course, they can also send them out to patients as well. We're going to make sure that we're working with our pharmaceutical and specialty pharmacy partners who to make sure that they're aware of the changes so that they can inform their patients as well. You know, I just want to reiterate, we are here for the bleeding disorders community. That's Hemophilia of North Carolina was founded by community members, and we continue to be led by community members. So please, if you have questions, call us. I definitely will never promise you that we have all the answers because I would be lying to you, but I can promise you that whatever it is, we will do to try and help you find the answers to the questions you have. Mike has already provided us with a bunch of good resources. I wrote down, I can't wait tomorrow to look at the portal and see that and check out everything that's there, and March 1st to download the app. But whatever we can do as an organization, we're here for you. You know, Mike, in your presentation, it was obvious that you care about North Carolinians as well, and making sure that people have access to the information that they need. So we thank you. We thank you for providing this presentation. It was fantastic.
Well, thank you so much. Again, I really appreciate the opportunity. I appreciate everybody who joined and stayed with us this evening past 8 o'clock. I thank you for your great questions. And Charlene, thank you for the offer to continue to promote this awareness around this big change. We are thankful for what you're doing, and we will continue to share the message. Let us know how we can do it better. We're open to ideas, and we want to be partners in this. This is a big change. I think it's going to be an exciting change for our Medicaid beneficiaries, but we want to do it right. We want to do it in a way that improves health for everyone in our state. So we're committed to that, and we look forward to working with you to get there.
Yep, same here. And we'll let you know too, you know, if we hear questions or things with such a huge rollout, you know, that's the thing, is there's always going to be hiccups. You hope that they're small, but it is what it is. It's like doing an event back when we used to be in person, or like the interpretations tonight. Things happen. So we'll make sure to be in communication with you if we hear of any, you know, concerns or room for improvement, or just questions about the process or moving forward. Just quickly, since we're still on, just one last question. Do you know, with managed care, will referral be needed to see a specialist?
Yeah, I think that's, you're going to get mad because I keep saying this. You'll have to double check with the health plan, but it's very likely you're going to need a referral to specialists. But I am going to have that one more caveat on my way out. You got to just check with the health plan about how that's handled. But I think it is quite common in many managed care entities already. So I think you can probably anticipate that, but definitely encourage folks to spend time learning about the plans and really take the time to select the one that's right for you. And I think it's a really great opportunity to have these choices. And I think we're excited about what that can do for our Medicaid beneficiaries.
Me too. Thank you very much. Everyone have a good rest of the night. Stay warm, stay safe, and stay healthy.
Thank you. You too.
Thank you.
Appreciate it.
Thank you.